Good morning, everyone. I am the opening batsman. A warm welcome from Delhi to delegates outside. Dear friends and respected seniors, my topic is screening, uniform antenatal care checklist, one nation, one protocol, step towards Viksit Bharat. Every pregnant woman deserves same quality care across the country. Standardized, evidence-based antenatal checklist for all gynecologists. The focus is early detection, timely intervention, and complete documentation. Goal being safe mother, healthy baby, and zero preventable deaths. Right care at the right time, everywhere. So we have the basic antenatal care checklist, the WHO model adapted for our country. There have to be 8 antenatal visits. The first visit to be before 12 weeks, and then onwards 4 weekly. After 36 weeks, it could be weekly or fortnightly, depending upon the individual case. The first visit, which is before 12 weeks, is the foundation visit. And you start with the LMP, the EDD, the status of being a gravida or para, a detailed medical history, surgical history, obstetric history, family, and mental health. So you as a clinician have a discerning eye. You can make it whether she's subjected to domestic violence or substance abuse. Even if she doesn't open up, do look into it. Identify the high-risk patients. It's a teenage pregnancy, elderly primary, short spacing. Look out for any medical comorbidities. Put a red sticker so you know that this patient needs a close follow-up or close monitoring. Use either the mother card or the Prime Minister Surakshit Matritva Abhiyan formats. The motto being identify early, act swiftly, and monitor closely. At the first visit, that is before 12 weeks, the universal test, blood group RH typing, hemoglobin CBC, rule out thalassemia, please do that. Blood sugar, at the very first visit, DIPSI is the way you monitor her blood sugar. TSH to be less than 3, viral markers, urine routine microscopy, a pap smear. Do not hesitate. Pap smear, if due, should be done during pregnancy. You will help her out. Otherwise, you might miss something. A dating scan at the first visit is a must so that you will know the exact EDD and then rule out any FGRs. And of course, a weight and a BMI and a BP at every visit. Look for red flag signs. Well, you look for her, the red flag signs. You please also educate the patient and also counsel her accordingly. Vaginal bleeding at any gestation. Feeling unwell, she has epigastric pain, abdominal pain, headache, blurred vision, fever, convulsions, reduced fetal movements towards term. Gestosis score is to be kept handy in every clinic. Look at this score. You find that just while you're taking her history, obstetric history, BMI and a blood pressure and a weight and taking a history of her medical comorbidities, you'll find that there is a risk factor and you can easily identify a patient who could be at risk for preeclampsia. Every visit is a must. Every visit is very important. In every visit, do a physical examination, which involves abdominal palpation and assessment of the fetus. A BP is a weight and her weight, hemoglobin, urine. Look for red flag signs. Educate the patient again for red flag signs. You have to go into her nutritional assessment, take a detailed history of her diet, breastfeeding counseling. Please do it at every visit. You don't want to feel miserable once she's delivered the baby and she has inverted nipples. Counseling on her personal hygiene and common discomforts. These were the universal tests which have to be done. Then there are certain important essential screenings. If she's RH negative, do an ICT before you administer antepartum anti-D. A GCT once done at the first visit has to be repeated at 24-28 weeks. A TSH is done trimester-wise. If she's hypothyroid, then you do accordingly. Ultrasound was done in the first visit as a dating scan. Then if you have facility for aneuploidy scan, and then at 20 weeks to detect for any anomalies. If you are worried about the fetal growth, if you're suspecting FGR or liker abnormalities, a scan again at 30-32 weeks, and then on with that term, depending upon how you assess her. Test early, track timely, and treat instantly. Nutrition and preventive package. Every patient is to be given iron and folic acid combination, a tablet containing 100 milligrams of iron and 500 micrograms of folic acid, and calcium which contains 500 milligrams. These are to be started at 14 weeks and to be continued postpartum. For calcium it is 6 months and for iron it is 100 days. Deworming. Every patient must receive 1 tablet of albendazole 400 milligram after 14 weeks. Immunization, 2 doses of TD. If she is in a government setup and if TDAP is not available, plus tell her, educate her, counsel her. You'll be surprised they'll be willing to get it on their own. And the same goes for influenza. Every pregnant patient should be immunized, whether or not she's in public or private sector. A diet, you have to give her some time. Talk to her about an iron-rich diet and which is protein balanced. The 100,000 days of nutrition start in the womb itself. And at the same time, while she's with you, have a look at her oral hygiene. This is a very important slide. 12 gram hemoglobin is to be taken as the hemoglobin. Anything less than that is to be treated as anemia. It is mild if it is up to 10, then you prescribe an oral iron folic acid combination. Moderate if it is hemoglobin is 9.9. You can double the dose, 1 tablet twice a day. But if there is a problem of intolerance, or you're not sure that she will take 2 tablets, do not hesitate to prescribe IV iron. Less than 7, she needs referral admission and may also need a blood transfusion, depending upon the duration of pregnancy. As the flow goes on and she keeps her visits constantly, you start preparing her for birth and delivery. She must know. You have to, give her, educate her, give her the knowledge, empower the woman. She must know where she's going to deliver the baby. How will she, what transport facilities she has, how will she move to that place, who are the people who are going to accompany her. This is the time when you again reiterate the red flag signs: bleeding, headache, swelling, reduced fetal movements. We have already been telling you that every visit must include a breast examination and breastfeeding, which is to be started within 1 hour post-delivery. This is the time to catch up for contraceptive advice. Post-natal visits are day 3, D10, and day 10. 6 weeks, if she is at a far-reaching place, then Asha Didi's role comes in. During this time, we all are aware of postpartum blues, postpartum depression. Look into her mental health. See that her partner is involved at every time. The care continues from antenatal to the postnatal. Educate her today, and you will empower an entire generation tomorrow. Then comes your role as your accountability and your action as a gynecologist. Do not use memory. Document everything you find. Keep a checklist. This is how you will find the red flag signs. You will get to know which patient needs excessive counseling, which patient needs more of monitoring. Monitor her outcomes, mentor your colleagues. The mission target is 0 preventable deaths by 2047, though Dr. Poonam said 2030. So a uniform training will lead to a uniform outcome. My final message is, together let's make Viksit Bharat safe pregnancy. Every pregnancy is a safe pregnancy in Bharat. Always remember the red flag signs. Thank you so much.